hard for us to keep up with him in his house. He goes that fast.
How does he?
He just gets around. And he's a motivational speaker.
He was.
What's his name?
Clay Dyer. A fast angler with no arms, no legs. He uses his good stuff and his chin to cast his rod and reel. He don't want no help from nobody. He goes around in his boat, he drives his own boat. I rode in his truck while he was driving. Beautiful, swims.
Good afternoon, Decatur, and thank you for joining us today. Our students have completed their first week of school, and we're honored to have the Superintendent of Education, Dr. Michael Douglas, joining us for a quick update from the Decatur City Schools. Dr. Douglas, thank you for joining us today.
Thanks for having me. 3 days in, we're excited with where we're at in terms of getting kids back. Obviously, we've still got a third of our student body that is at home, getting classes virtually. But for the most part, I think traditional school, which we've opened, since the little one-room schoolhouse, we're used to that, and that went well. We are still working through the virtual and the kid that stayed at home. We spent the majority of those 3 days getting devices in hands of parents, getting how to log in. We'll continue that this week, and then hopefully we'll get started with them probably midweek. As I say in every parent video, just give us a little time. School normally slows down after Labor Day, and we'll go from there. We have had some isolated COVID positives. We've been very transparent with our community, and we'll continue to notify you. Obviously with every positive, we do go through contact tracing and make sure that we quarantine. And I would just tell our parents that is so important, the quarantining, because even though your child may not come back positive, if they did, that would just cause a massive spread. So we really have to follow the guidelines, and the guidelines are great. And I think that's why our cases have been a sporadic here, rather than a huge outbreak, is because we do that contact tracing, and we quarantine as many people as we deem would be appropriate. So once again, I hate the fact that your child may be sitting in a classroom and show no symptoms and be negative, but we've got to quarantine them for 14 days. But that is for the health of all of our students and our teachers. This is just unique times, but in terms of the first 3 days, traditional went really well, and we've just continually asked for our virtual parents to, just give us a little time. Unlike a normal school year, we didn't close the school year out. And so opening it when you weren't allowed to have in-person meetings with teachers and faculty. So the opening was even a unique thing. But in terms of where we're at, I feel really good. I just see, once again, I ask our community for a little patience and a little grace. So thank you for having me, though.
Sure thing. Absolutely. Thank you. So we're also grateful that the Alabama Department of Public Health has now listed the risk status of Morgan County as low. What we're doing as a community is working, and just keep on keeping on is the message that we want to give you. So we also have with us today Chief Nursing Officer of Decatur Morgan Hospital, Anita Walden. Anita, it's good to have you back with us again. Thank you for everything that is taking place at Decatur Morgan. So just a few municipal updates. Currently in Morgan County, we have 2,515 COVID cases. That's less than a 5% weekly increase. So we're still strong as it relates to the numbers going down. Let's stay the course for the sake of our schools and our economy. It's a matter of personal responsibility to keep the momentum going. We must socially distance, wear our face mask, wash our hands, and disinfect. And we have to do these simple tasks to keep ourselves well, keep our families healthy, and sustain our local economy. City Hall is open. We are doing business. We ask that if you would, to please reach out to us by email or phone call to the department that you need to do business with. It might very well save you a trip here to City Hall. Also, it's important, if you have not done so, to complete your census at my2020census.gov. That's my2020census.gov. And then we also want to remind you to stay in touch with those in your neighborhood. Be sure to especially check on our elderly neighbors. So with that, Anita, you have an update from the hospital?
Absolutely. First of all, thank you for having me.
Sure.
We're always grateful to the City of Decatur, to the Morgan County community, To the various churches, businesses, individuals, groups, to our Huntsville Hospital system. They have been great in their leadership and keeping us updated with our affiliate information and working as a team. You know, we bounce ideas off of each other, and we share things like PPE, all those kinds of things. And then I am mentioning them lastly, but they absolutely are dear to my heart, our DMH team. The Decatur team is just wonderful, whether they're clinical, non-clinical, frontline, our leadership, and also to our physicians. You know, this has been a tough thing. We don't have a playbook to go by. We have had to figure it out as we've gone, and we've relied on our state leadership, our federal leadership, and each other, and just tried to figure this thing out. Our patients are sick. COVID patients are sick. PPE, just the donning and doffing of PPE is exhausting. So please, when you see our team members, please thank them. We handed out T-shirts to them last week, and we were able to give every member plus our physicians a shirt, and they wear them on Friday, so you may see them in these shirts out. We hope they will wear them out. And when you see somebody with "I'm a hospital hero," thank them. They would appreciate it. And please don't forget them. If you have, you know, things that you want to do, charitable things, if you want to feed them, if you want to send them cards, anything, keeps their spirits up. I've had I guess you would say, the privilege of having a family member in the hospital recently, in my hospital in Huntsville, and I was amazed at the teamwork that I saw going on. They take care of patients, all patients, not just COVID patients, and I appreciate that and understand that they're still doing business every day. We're taking care of every sick patient that comes to us. So if you're sick, don't be afraid to come to the hospital. They're taking the proper precautions, and I saw that up front and personal. By the numbers, our patient cumulative testing so far at the hospital, we've tested 2,768 as of this morning. Of those, we've had 396 positives, so we're at approximately a 14% positive rate. 22 are inpatient today, and 13 are under investigation. So we're treating them as though they were positive, which means we're dressing out, we're treating them as such. 5 of those are in the ICU on a ventilator. And then we have 1 in the ICU that's under investigation. They're also on a ventilator. Those are the sickest of the sick. Our fever clinic, we moved it from Hartselle to the Parkway campus. So it's open Monday through Thursday. We do not require a physician order. We test for employer and school clearance, or if there's been an exposure. Just bring a photo ID and an insurance card. That's to assist you in filling out your paperwork. And if you're having difficulty, we will help you with that. We're open Monday through Thursday, 9 to 12, closed for lunch, and then back open 1 to 3. Our results are called back to you on Monday through Saturday, and our results are usually back in about 3 days. It can take up to 6 depending on the volume of testing in the area. Please wear a mask. You drive up, you don't get out of your car, but when you roll down that window, we really need for you to have on a mask because that's close proximity to our testers. In our clinic so far, we've tested 1,826, and we've had back 246 positives. So our positive rate is close to what we're seeing in the hospital. It's about 13.5%. You know, it's been 155 days since we started this COVID journey at our hospital. In just over 5 months, I can't believe it's been 5 months, but that was the first time that we met as a team and discussed COVID and what we're going to do about it. About day 16, we had our first positive patient, and the first week of June, we doubled those numbers, and we've kind of not looked back since then. Now, we've gotten as high as 35 at one time, but we've averaged about 27 since June. In addition to that, we've had about 7 to 12 PUIs, or persons under investigation, every day. And I just remind everyone that the PUIs require the same amount of PPE as if they were positive. We treat them in that manner until, and that's to keep us from being exposed and to keep other patients from being exposed. We still do have a COVID dedicated unit, and but like I said, our sickest are in the ICU, and then we do have a few that are also in our step-down unit as well. So patient volumes at the hospital. We've seen about a 50% decrease in our West patients. Now, hospital, we decreased our elective surgeries, but we saw other sicker patients. But I think the group that we've really not thought about is our mentally ill patients. And just like at a nursing home, we absolutely cannot afford to have a positive patient at our West campus because they don't stay in their beds like everybody else does. They roam around, and that is part of their therapy. So we have seen a great decrease there, about 50% in June, about 54% in July, and we're slowly coming back up. We're at a 41% decrease for August so far. But we're seeing those numbers rise, and we want them to rise. We need to get our mentally ill patients out of our EDs and where they belong. Now, we do experience some decreases in the summer due to kids being out of school. And then when they get back in school, they just can't handle it. And sometimes, that's when they come over. But we're being extremely cautious there. They must have a negative test before we can admit them into West. Visitation continues to be very limited. We believe that our patients need to have a loved one with them if that's at all possible. We do not allow visitors with our positive COVID patients for obvious reasons. We cannot risk that exposure, and we don't have enough PPE to supply to every single loved one. End of life and compassionate care. I don't know if you read the Decatur Daily yesterday, but there was a wonderful article about one of our patients, one of our first patients that passed away. And we have a palliative care nurse that is fantastic, and she was able to make that connection for the family so that even though physically he passed away alone, he did have a nurse at his bedside. And she was able to keep the family involved through his case. So wonderful story, very sad, but wonderful. Our med-surg patients are allowed a caregiver as needed. Our labor and delivery patients can have a support person with them. And of course, children can have their parents with them. So, team member safety. Our team does an amazing job. A really amazing job of keeping themselves safe from exposures. However, when a patient and or a visitor does not answer the questionnaire questions correctly or honestly, our team and other patients are left very vulnerable to exposure, and that does happen. And so please, I plead with you, it's not anything to be ashamed of. If you know you've been exposed or you've had COVID, please let us know that. It's important that we keep everybody safe. When there's an exposure, as Dr. Douglas spoke of, we do the same thing at the hospital. There's a process that you go through. And so everybody is determined to be a low or a high risk. And depending on that, they're either self-monitoring or they're quarantined. Please, please, wash your hands. Social distance. Wear a mask. If you don't want to do it for yourself, please, if you care about anybody else, wear a mask. Thank you.
Thank you. A lot of great information there. Thank you, and thank you, Dr. Douglas, for coming over. And I know trying to get on the other side of Labor Day right now. Is that right?
Absolutely.
Very good. All right. Well, I don't think we have any questions. So with that, Dion, you have a question?
To Dr. Douglas, we started the first week of football. Can you give us any hints about how it's going to take place?
Yeah, we, Coach Parker put out some guidelines. I think you guys have received it, but it basically lets all of our fans know, we are going to require masks in the stands. We are going to monitor capacity. We haven't put a set number on that. Obviously, indoors, the capacity is going to come way down in terms of the percentage. Outside at football games, we'll just have to gauge it. We feel pretty good about this Friday, but an Austin-Decatur game, which will be in 2 weeks, we will have to probably limit capacity. We are going to let the band perform before the game. That was one major change, so that they're not getting in and out of the stands. They'll perform before the game. And then our visiting band, we're all visiting bands. It'll just be pep bands. It won't be an entire band. Halftime and all of the comings and goings is when, that's when we have the most possibility for exposure. We are going to a ticketless system to where we're not changing money out. Obviously, Mr. Satterfield and Coach Parker have worked tirelessly on that. I want to thank them for theirs, but it will be a unique experience, and I can't say. We may make adjustments, but yes, that does start this week. But expect those changes and probably others that I haven't mentioned.
What's the concession stand, Dr. Douglas?
Obviously, we won't be changing money. We'll have it marked off. But we are planning. That may change, but we are planning.
All right. Very good. Well, look, thank you both for being here, and thank you for joining us. And we'll return Monday, August the 24th at 10 o'clock. Have a good week.